Hello, today I'm going to talk about a medical condition called endometriosis. I chose this topic because I want to be a nurse and also because I have a very close friend who has this condition. Some of the things I want to talk about are what is it, how it develops, how a doctor will diagnose and treat it, and how it affects a woman's fertility and reproduction. So what is endometriosis? Inside the uterus there's an endometrial layer, and the cells get out sometimes and they'll attach to the ovaries or the fallopian tubes. They can also attach in your intestines and also in your colon. Now, doctors aren't 100% sure how the cells get out. Some other theories include a possible transfer from a past surgery the patient may have had, or a backup of the menstruation flow that pushes the cells out. So now that you know what it is, I'm going to talk about how it's diagnosed and how it's treated. The only way to be 100% certain that a patient does have endometriosis is by doing a procedure called a laparoscopy. It's fairly invasive. All it is an incision cut in the abdominal cavity and a tube-like device stuck in with a camera at the end where the doctor can see all the organs. The doctor obviously has to suspect that you have this in order for you to have that procedure done. Some of the ways that they'll suspect this is if the patient complains of severe abdominal pain. It could be during menstruation, but I think generally it's done, the pain is just in general constant. Another way a doctor can suspect it is if you go in for an annual exam and a lot more pain and discomfort than is normally expected during the exam. They may ask you some questions, but they'll probably poke around a little bit, and they may actually be able to feel the nodules on your ovaries. This can't be 100% conclusive, obviously, because the doctor's only feeling something. They can't physically see it. So it makes it kind of hard to make a call, considering that women can also develop ovarian cysts, which is just a sac of fluid that will develop on the outside of the ovaries. It could possibly feel the same to a doctor, and it also will exhibit the same symptoms such as the severe abdominal pain and discomfort. Some of the ways the doctor will treat this is by prescribing the patient an anti-inflammatory such as naproxen. It'll decrease the swelling and may assist with some pain management. Another thing that will be prescribed is a hormone pill or possibly an injection. My friend, for example, is taking what's called progesterone. Now, these hormone pills will stop a menstruation flow and decrease estrogen in the body, so that way the nodules will shrink and hopefully go away. And the hormone pills have a lot of side effects that come with them. My friend, for example, vomits a lot, very sick, has a hard time eating, until her body gets used to the medication in her system. The last thing the doctors will resort to is surgery. If the patient's case is severe, let's say it's overrun the entire reproductive section, the doctors will end up probably doing what's called a hysterectomy, which is basically removing all the reproductive organs. They can also probably go in and remove some of the nodules. For example, if it's in your intestines, they can remove a certain amount of your intestines and hope that it goes away that way. The last thing I want to talk about is fertility and reproduction. How does this condition affect that? Women who have mild to moderate cases of endometriosis can still have children. My friend, they suspect that she possibly has a severe case. They haven't done the laparoscopy yet, so they're not 100% sure. But she has a son. Her son is a couple months younger than my daughter, so it is still possible to have children. There may be some obstacles anatomically involved, only because of scar tissue that may have built up. For example, if it builds up in your fallopian tubes, it may cause obstructions for the egg to flow down during ovulation, and obviously severe cases, if they've had a hysterectomy, they can't have children. Today I've talked about endometriosis, told you a little about what it is, and hopefully this information was useful in understanding a condition that affects women around the world.